right, we're here today with Dianna, and Dianna's about to start her procedure with Dr. Davis. So, Dianna, tell me a little bit about those knees. How long have they been bothering you?
Well, I've had problems with one of the knees for a couple of years, but the left knee just started getting worse 2 months ago, and I tried all kinds of other procedures.
Like what? What have you tried?
I have tried doing the injections, the high algae injections.
Right.
And then,
did that help?
It helped on the right knee. It lasted about 4 years, but I just had the high algae treatments done in August on the left knee, and a couple months later, the pain, the swelling, it didn't work.
So what's a typical day for you like?
A typical day is feeling like an invalid right now, and not being able to do all the things that I like to do, like moving around, walking, shopping, getting into one of those carts at the grocery store is kind of hindering for me, because I feel humiliated that I have to be in a cart.
Because you seem like you're very independent.
Yes, I am. Yes.
I've gathered that just from the few minutes we've talked. Good, good. So what was your discomfort level today? What are you feeling right now?
Right now I'm feeling, because I've been moving around a little bit, I'm feeling about a 7.
Okay. And is it the more you move around, the more it hurts?
The more I'm standing or walking, the more it hurts.
Okay.
But when I'm sitting also, it's hurting, because I need to stand up and move around.
So you're kind of like darned if you do, darned if you don't,
yeah.
right?
Between a rock and a hard place, exactly.
All right, I'm going to have you do a couple things here, and I want you to really focus on those knees, where you're feeling it, if it's a sharp pain or if it's pulling, where it's pulling at, because that just gives us an idea of to where we're going to start with your procedure, what group of muscles. So I'm going to have you stand up for me.
Okay.
Okay, and you had to have some assistance with your hands.
Yes.
Okay.
I can do it on my own.
Where did you feel that?
I feel the pain in the knee and all down in here.
And it's running down your leg?
Yes.
Okay.
From here to here.
Okay.
Yes.
And how was the low back? Did the low back bother you going from sitting to standing?
Not right this second, no.
Okay. All right.
Standing too long, it would begin to hurt.
Your back would start to hurt. Okay, I'm going to have you take 2 steps forward. All right, put your feet shoulder length apart. Put both arms out in front of you. And I'm keeping your heels on the ground. How low can you go? Right there. Okay, slowly come back up. Where did you feel it?
I felt it in here.
Okay. Was it like below the kneecap, do you think?
Below the kneecap.
Okay. All right. The sun does look really good on you, by the way.
Oh, thanks.
All right, I'm going to have you go up and down the stairs.
I can hold on, right?
Yes, you can. Absolutely. I want to see how you go up and down stairs.
Okay. Well, this is the way I do it. Yeah.
Okay, and that way you don't feel as much pain, correct?
Right.
Okay, now we're going to go back up the stairs.
Okay. And I'm using my right leg because it doesn't hurt as much as the left.
Okay, so you're using your good leg, which is your right leg, to go up. Okay.
Exactly.
So out of all of those 4 different exercises we just did, which one caused you the most discomfort?
Getting up.
Getting up, going from sitting
And
to standing,
squatting.
and squatting?
Yeah.
Okay. Now going up and down the stairs, which is, I'd have to say, going down the stairs is probably more difficult for you.
Going down the stairs backward is not as difficult as walking up the stairs.
So up you were feeling more discomfort.
Discomfort.
Okay. All right. You ready to get started?
Yes.
Let's do it. All right. We're back with Dianna, and Dianna's finished her procedure with Dr. Davis, and boy, is she smiling. I'm going to have you stand up for me.
Oh.
No assistance.
It's a little resistance, but
Yeah. All right. Let's try that squat, okay? Feet
All right.
shoulder length apart, arms out in front, and let's have you squat down.
Oh my gosh.
Wow.
That was further than last time.
A lot
wasn't it?
further than last time.
Yes.
Okay, so let's try the stairs, but let's try forward this time.
All right,
And
let's
let's
try
just try 1 foot per step, okay? You hold on to that railing, yep. And just do 1 foot. There you go. Do the other. Look at that.
God, yeah. That's
Now this is going to be, you're going to have to practice on that
Yes.
because the brain still wants you to turn around backwards and go down,
Right.
but there's no pain there.
No pain.
So let's go back up the stairs
All right. I'm going to try it with this foot now. Oh,
with the opposite foot too.
yes.
Dianna, how are you doing?
This is like a miracle, I swear to God. After 2-3 months of pain and now an hour of a little bit of therapy and I'm walking.
So you were at a 7 when we started. What do you
Yes.
think you are now?
I have to say maybe a 2.
Okay.
Maybe a 2.
Maybe a 2.
Yeah.
And it's more the soreness
It's
from the procedure.
soreness from
Okay.
the procedure, but I would do that anytime. Just to
So what would you tell other people out there?
Oh my God, if you are thinking at all about having a knee replacement, come to Dr. Davis first because he is incredibly wonderful and the nurses are wonderful. Yes.
Welcome aboard, Dianna.
Thank you.